to just start us off with a bit of background to the training and how it can be accessed.
So
hang on. Nicholas has lost sound. I would suggest... Oh, he can't hear us. I will quickly type in...
There's always some form of tech issues, isn't there?
I know. Yeah, we've all said the same. If you try to leave and come back. There you go, he's tried. Let's have a look. Yeah, absolutely. I'll send the recording out to everybody and also the slides. That would be really helpful, I know. Let me just see if Nicholas can hear us.
I hope people don't mind. I'm just going to mute any attendees just so we've not got any sort of background noise for everyone. So I'll just leave me and Vic off mute for now. So if you want to ask a question or anything, that's why. If I won't be able to hear you.
Yeah, so do unmute yourselves if you need to ask a question. But yeah, usual kind of stuff. If you need to pop away for a minute or two because schools are schools and they don't stop because you're in a meeting, then please do that. And yeah, as I said, I will send out the recording to everybody and the slides as well. And also, hopefully, all questions will be answered today. But if you do come back and you're kind of like, oh, should I ask that? Then obviously just drop me an email. Okay, Charlotte, I'm going to hand over to you.
Brilliant, thank you. Yeah, so just like I say, my name's Charlotte Wilson. So I work for the Department for Education as the South East Delivery Lead on the mental health support teams and the Senior Mental Health League grant. And it's just a little bit, my job is here to promote the grant. I know Vic is going to do some very good work later on a couple of different courses. I have to sort of caveat that I'm not here to say which course is the best or which is the worst. My job is to say what is out there for you. I had to make sure I said that for other people. So what is the Senior Mental Health Lead grant? So it's £1,200 and it's a free grant at eligible state-funded schools and colleges in England. And it is to train a senior mental health lead who can then develop and implement a whole school or college approach to mental health well-being. And it's there to fit within the 8 principles of the whole school and college approach, which you can see on the right. I'm not going to go speak to every single one of them, but it's all about enabling student voice, supporting student and pupil well-being, but also supporting staff well-being as well. Now, the training isn't compulsory, but it is part of the government's commitment to offer the training to all eligible schools, and it is running until 2025. So my sort of theory and consensus is if you don't get it spent, then it will get lost and the money will go somewhere else. So I would definitely recommend using it. And it's a strategic development and it will help with setting holistic approach to mental health and well-being. I will just start now, which I think is the question I often get asked, is we've already had the grant, someone's been trained, but then they have moved on and left. Unfortunately, you are not then eligible for the grant again. You can access the training and self-fund it, but once the grant has been provided, the £1,200, regardless of the staff members left, you cannot have the grant again. Unfortunately, if it ever changes or if anything's edited down the line, I'll let people know and I'll let Vic know and she'll be able to disseminate that. But that's the lay of the land at the moment. Thanks, Vic. Next slide. So what's the senior mental health lead role? Some schools, when I've been talking to them, call it designated lead or mental health lead. There's lots of different names, but from myself, we'll just keep calling it a senior mental health lead. So they have a strategic leadership role in the school or college, and they're responsible for overseeing the setting's whole school or college approach to mental health and well-being. Now, we always say that to identify a senior mental health lead, you have to take into account some factors. I know how busy schools and colleges are. I was a teacher myself, so I'm not just sitting as like having not done this and been in sort of your shoes. So I do appreciate how busy everyone is. But we often say that the person to best place to take on the role is someone that often doesn't have as much teaching time because they need that time to be able to develop it. So it often ends up being a head teacher, deputy head, member of SLT, or someone like the Senko, someone like that who's got that extra time within their timetable to have it free to be able to develop this work. And yeah, just I preceded myself there. Eligible settings are only be able to claim one grant, but the grant, regardless of how much the course costs, is £1,200. Some courses cost less than others, but the rest of the grant can be used for providing cover, for example, for the person that's going on the training, or buying resources, buying tools that you'll need moving forward. Thanks. So, we at the DfE have over 100 quality assured training courses, and this has actually come down quite significantly. There's been a lot of work recently on making sure that any dormant or sort of really not well graded courses have been sort of removed. And I know this firsthand because I sit next to the person that leads on quality assuring the courses up in Sheffield. So we currently have over 100 courses to choose from, and all courses are aligned with the 8 whole school college approach principles. And I'm sure Vic will send these slides around, but you can get a list of providers here. All the courses have full flexibility, so some are beginner, some are intermediate, some have varied time commitments, and I think Vic's going to go into different opportunities later on. But the grant, like I say, regardless of the cost, is always £1,200. And there are some online tools as well to help select the right course. Again, you can have a look at these at your own leisure, and you can filter it by different time commitments, different learning styles, online, face to face, however you feel was most suitable for your school. So it's really simple to claim the grant for the setting, and this has actually again been worked on to make it simpler. So it takes 5 minutes to reserve a grant. That will now say 23-24 financial year, because I think since me and Vic have organised this, the times have changed, and I probably sent an old uh, thing, so blame me, not Vic. So form 1 is to confirm eligibility and allocate the grant. That's basically just to make sure that you are an eligible school and you've not had the grant before. Then you'll get a confirmation email back, and you can then book your chosen DfE assured course. And then you'll be sent form 2, which is you then upload your course booking evidence, and then payments will be made back to the school on a quarterly basis. So just a little bit of feedback. I think it's always really good to hear about from people who've actually done the training. So Charlotte Reed has from Hampshire has very kindly written a blog about her experience of the senior mental health lead training, and there's just a few bits of feedback there. But trainings helped us make decisions about mental health support, and they're tailored to our school's needs, and there's time to clarify the ideas through the support of a dedicated coach and deep dive into our provision and support. So that was Hannah Woodhouse of Moorlands Primary School up north in Huddersfield. And I won't read them all out, but there's further information as well on the gov.uk page, which is a link there. But we also have an email address if you have any queries or questions. If it's something you're thinking, oh, I don't know, maybe I need to ask more questions, you can send it to the mental health lead training education email address, and that always is monitored, so they'll be able to get back to you. So, what if let's say you've sold on it after this meeting and you want to get the senior mental health lead, go and just click on the link when the slides come out, and you can confirm your eligibility and allocate a grant. You then need to decide on your colleagues, who's going to take up the role of senior mental health lead. And we just thought put a few questions there to think about. Is your setting ready to take it up? Oh, sorry, back one. No, it's fine. Is your setting ready to take up the training opportunity before the end of this financial year? It was quite lucky because we're only in July, so that's not until the end of March next year. Who's best placed to lead on the development? And then you can secure your grant. So now will be if anyone has any questions at all for me, or I'll let Vic move on and look at some different courses for you. Oh, yes, go Mrs. Brown, Bill.
Hello, it's Julie. Yeah.
Hi, Julie.
obviously there's lots of different courses, but what would you say in general is the sort of time commitment that you have to give to this and time scale?
This is the thing, every single course is a lot of different, so I couldn't give you sort of one specific generic answer. But when you go onto the link that will search the courses, you can put in, filter it for time, sort of commitments, and Vic is going to show a few later that are a couple of days or ones that are a bit longer, so she'll give you a bit of a flavour for them. But you are able to filter it and you have a little look on the site.
Okay, lovely, thank you.
Yeah, if you are looking at a course and you can't find kind of how much time commitment it is, do get in touch with me, because I might know which other schools have done it already and they might be able to kind of tell you how much time commitment, because some of them, even though the time commitment to actually access the course is, say, 2 days, some of them have work that you then have to submit and others don't at all. Others it is just the 2 days. So it is kind of, yeah, there's no kind of guidelines at all.
Yeah, it's each is individual to each course. So
Yeah, exactly.
That's great.
Any
Thank
other,
you.
no worries. Any other questions for Charlotte? Brilliant. I think you're going to stick around, aren't you, Charlotte?
yeah,
And
I'm going
then
to say,
we'll,
if people
yeah,
think about them, I'll monitor the chat as well whilst you're
brilliant.
presenting on this bit.
Perfect. Thank you. Okay, dokie. So, as I kind of said earlier, we were really aware that actually part of the reason some schools haven't accessed the training is because the overwhelming choice, and actually, as Charlotte said, there's over 100 courses to choose from. And actually, when the grants were first kind of brought out, I had lots and lots of emails saying, we don't know what to pick, what can we do? And actually, at that time, I wasn't aware of any of the content of the courses. The courses don't really share content with me because obviously they're worried that we might create our own course, which is something that we are looking at, whether West Sussex creates their own course in the future. But I think that would be probably in addition to the DfE. So don't worry, don't hold off and don't apply for one of these, because we will probably fund that for our schools. Yeah, so we were really aware. And when we surveyed schools, we actually found 25% who had done the course. So those who had already navigated too much choice. And so that's why we decided to meet today. And just like Charlotte, I can't recommend certain courses to you. Obviously, we're both kind of bound by our employers, and representing West Sussex and the DfE, we can't favour one course over another. What I can do, though, is give you feedback from other mental health leads who have completed the training. So from the senior mental health leads who completed our survey, so this was a survey of senior mental health leads within West Sussex. These were the courses that came out consistently high. And actually it's quite interesting because they're all three really well-established providers who actually, before we even knew about the courses, if people came to me and said, I don't know what to do, I actually said, well, I don't know either, but these are the really established providers who would probably give a quality course, and that is exactly what's happened. So the Anna Freud Centre for Children and Families runs their course. I'm going to have a look at all three of these in a bit more detail. Leeds, Beckett and the Carnegie School of Education, they have several courses that they run, but everyone who has accessed them, their courses, again, has consistently given them 5 out of 5 for trainer knowledge, and all agreed that it was good use of their time. And similarly, same with creative education. And for these courses, these ones that came out really highly rated, they all took place online, apart from one participant who did a blended learning option with Leeds Beckett. So Leeds Beckett, because they do have several different courses, they have different options around whether you want to do solely online or you want to do a blended thing. And they don't expect you to go up to Leeds if you're doing a blended course either, because they do have kind of regional outreach sessions that they put on. Let's give you a quick overview of kind of these top 3 rated courses that we've come across. I just wanted to have a look at them in a little bit more detail. So the Anna Freud course is completely online, and it's 2 days. I don't think they're 2 days back to back. They are maybe a month or 2 apart. And you can see here exactly what they kind of cover in each of the sessions. So you can see day 1 covers their first 4 modules, again, very much based around those 8 principles of the whole school approach. So understanding the role, looking at need within the school, and then a large part, a whole module about actually supporting staff, and not just supporting their well-being, but also supporting them to be able to feel confident in working with students around their well-being. And then looking at embedding mental health and wellbeing into the curriculum. Now, for us in West Sussex, we have the Education for Safeguarding curriculum, which at the moment, until June next year, is still free to access for all schools. So if you haven't got your login for that and you haven't accessed that yet, please do get in touch with either me, or if you have already got an email address for the Education for Safeguarding team, get in touch with them, because at the moment that is still free until next June. And then you'd have a break, like I say, 1 or 2 months, and then the second day would then cover how to make provision for those harder to reach groups, and then looking at the targeted support, so the one-to-one support for young people that maybe need more support than the whole school approach can cover, and then creating a targeted approach for referrals, so how to put in really good referrals, how to know when to send out referrals and to which services, and then looking at engaging the system around the child. So it could be parents and carers, it could be the wider community, it could be other services within West Sussex. So that's the Anna Freud course. And then the Leeds Beckett one, as I said, they actually offer a range of different courses. So I'm going to just concentrate on the intermediate one to kind of compare it to the Anna Freud one, because the Anna Freud was at an intermediate level, but there are quite a few different ones that they offer from beginner right up to expert. And I think they even offer, as part of this training package, they even offer a master's level course, to which you can, obviously it's more than £1,200, but you can use the £1,200 to pay towards it if you wanted to go that high. But the other courses fit within the price range. So for their intermediate course, it is online 2 days, and as I said, there is also that option for a final session to be completed face to face. However, it's a bit different than the Anna Freud, in that the Anna Freud is quite concentrated into those 2 days, and as I said, it is in the 1 to 2 month time range, whereas this one you are given the 8 units to kind of do yourself over 6 months. So there'll be 2 contact days, but actually you then have to kind of do that self-directed learning of the 8 units over, and you have 6 months to do those. What's really interesting about the Leeds Beckett one as well is that they've recently added 2 new specialist courses around alternative provision and special school settings, which is something we were asked about quite a lot as well, kind of like, well, actually the main offer isn't going to fit my school, but Leeds Beckett have actually looked into that to see what else could be offered for those settings that's more specialist. So again, to compare the intermediate content compared to the Anna Freud, so it is quite similar. So the leadership and management, looking at your role and working collaboratively with other services within the area. And then again, Anna Freud split this next one into 2, so they had one for targeted support and one about appropriate referrals, but they keep them both together here at Leeds Beckett. Identifying need, and then it does really follow those 8 areas. So creating an ethos and environment, enabling student voice, the curriculum, leadership and management, and then Unit 6 is a deep dive into your own provision. So that really helps you to understand what your needs are, and then you can then bring that back into the other units when you're looking at your curriculum, when you're looking at leadership and management. You'll be able to apply what you've learned in your deep dive to do your planning, and then take that also to regional conference, where you'll be able to talk it through with some of the course leaders and also other senior mental health leads. And then the third one that came out really highly rated amongst our participants in West Sussex was the Creative Education course. Some of you will be familiar with Pookie Knight-Smith, who is the Director of Creative Education, because she did some work for us in West Sussex around our self-harm learning networks. So Pookie created some of the content around training for parents and school staff around self-harm. If you haven't accessed then those, they are brilliant videos, and actually I'll give you a bit of a taste of how creative education might present some of their courses as well. So creative education offer either online or face-to-face. They are based in East Sussex, so not too far to go for face-to-face. If you do face-to-face, it's 2 full days, 2 months apart. If you do online, it is self-guided, so you can kind of do it when you have time rather than trying to fit in those 2 full days. And then 6 coaching sessions provided by members of their team, and that is spread across 2 terms. What schools really highly rate of creative education is that you then have a year's access included in the course fee to all of their CPD content. And I don't know if any of you have ever accessed their CPD content. It is vast, and it goes from these kind of bite-sized ones that are 10 minutes, and that they are all different levels as well, right up to full hour and a half, 2-hour CPD sessions. On most of it is around wellbeing and mental health, but also around other aspects of teaching and learning as well. And it really is, it can cover all kind of stages of teaching as well. And some of them are aimed at TAs, some of them are aimed at senior mental health leads, some of them are aimed at head teachers, but it is a really extensive package that they offer. However, what they don't offer is a really clear module overview like the other 2 did. So as I said, courses aren't usually particularly keen to share their full content with me, but what I have been able to get from them is that it will cover, again, leading the whole school approach, working effectively with colleagues both within school and around other services, again, identifying need, and actually there's a bit more input in this one around actually effective interventions within schools, so kind of practical interventions that you can put in place in school, and then working effectively with parents and carers. I just want to check if we do have Angela here. Angela Baxter was going to try to join us from Warden Park Primary School, who has completed one of the courses. But as we know, it's getting towards the end of term, and she did say that she might not be able to make it due to cover. No, she's not here. Okay, what I will do is I will speak to Angela and just see if she can maybe do a quick little add-on interview with me that I can then send out to people. But I was going to ask her about which course she did and how she decided on it, and kind of how easy it was to book and what she found particularly helpful. But what I will do is talk you through what other people said about this. So we asked them what they had done in school since completing the course, and there was a vast array of different things that have been put into place. So one school has set up a mental health working party since completing the course, where they were really making sure that the provision that they put in place actually suits the needs of their school, and particularly around staff mental health. Quite a few schools had, since completing the course, created a mental health policy or rewritten their mental health policy. Quite a few of the courses suggest carrying out a mental health audit. Some of them provide you with an audit. Others just ask you to do your own audit. Now, some of you will have accessed our West Sussex reflective tool, which looks at all 8 principles of the whole school approach and allows you to quite quickly drill down and find out which areas of your whole school approach you're strongest on and which areas you might want to kind of look at developing. If you would like a copy of that reflective tool, please do let me know and I will send it across to you. Somebody analysed the current provision, what they're already doing, and making sure it was fit for purpose and making sure it was fit for their audience. Someone now said that they were able to make more effective referrals since completing the course. Improved in-school support. One member said she felt so kind of empowered at the end of the course that she was able to provide CPD for her staff, and she could do that quite confidently. A couple of schools actually have said that they've created more roles to support wellbeing since going on the course, since it's kind of highlighted to them where the needs might be and what kind of roles might be able to support at an in-school level. So I know that quite a few primary schools in the area at the moment are employing their own family support workers, and I came across a secondary school the other day who has recently employed a HTLA HLTA, just for emotionally based school avoidance. So that was quite interesting as well. And then one just said they really had confidence in it after completing the course to be able to drive that wellbeing agenda forward with their governors and with their head. Anybody got any questions so far? You can either unmute or put your hand up or type it in the chat. No, I will carry on then. And then we also asked about what were their planned next steps since having done the course. Some of them said that they were really looking at their online support for parents. So from the course, they had taken lots of ideas around how they could provide this. And that was what they were going to start developing as their priority. Again, just to make you aware that every school in West Sussex is able to access the Thoughtful, so the mental health support team's YouTube channel, and on there we do have some parent webinars. We have ones for primary age parents of primary age pupils, not primary age parents, parents of primary age pupils, looking at anxiety and how to support anxiety, and also just really normalizing those anxious feelings and how parents can help to normalize those anxious feelings and not over kind of worry their children with their own anxieties, and also about resilience. And then for the parents of secondary age children, we have some webinars around understanding the teenage brain, how to talk to your young people, understanding and supporting anger, anxiety, low mood, and then when there's a session around parent self-care as well. So again, I can send out the link for the Thoughtful YouTube channel. You can have a look for yourselves. One school had decided they were going to set up mental health ambassadors. For those schools who are part of the Thoughtful programme, mental health ambassadors is something that they offer to schools. They offer the training. For those schools who are the rest of our schools who are not part of that programme at the moment, I'm looking at how I can put together a train the trainer day for schools who would like to take mental health ambassadors forward within their schools. Again, some schools realised that they actually probably needed to recruit some more specialist roles within wellbeing since completing the course. Other schools felt more confident in monitoring their wellbeing since completing the course. One school was looking at doing the advanced course, so perhaps they'd done the Leeds Beckett one and they wanted to do a more advanced course. As Charlotte says, it would then have to be self-funded. In fact, any of the courses you can self-fund at any point. They're not just open to those that have applied for the grant. So they obviously decided that they would like to prioritise finding the money to do the more advanced course. Again, more parental engagement. One school, really interesting, was looking at restructuring their timetable for next year to really prioritise wellbeing within kind of a daily practice within the curriculum. So that was really interesting. I'm suspecting it probably was one of our smaller primary schools, though, who has that bit more flexibility than some of our big secondary schools. One school had started to make steps towards applying for the Wellbeing Award, and one of them had set up was going to set up a wellbeing forum in school, which would take in parents and carers and young people and staff as well, to really give a really whole school view of where wellbeing is at and what people would like to see to improve their wellbeing provision. And then, as Charlotte explained, every school gets £1,200. That is the blanket grant. But some courses cost less than that. So there will be some underspend that you are able to use. The expectation is that underspend will be used in some way supporting the work of the senior mental health lead. I know sometimes the money can kind of disappear into the ether of schools, but it really is the expectation that money will be used around wellbeing. So we asked schools what they had done with that underspend. One of them had bought resources for their new nurture group, which they'd set up after having done the training. Again, other schools or other mental health resources into school. Lots of schools did say that actually they used it for cover so they could complete the work. Further training. Another one decided they wanted to access online courses, and then one school in particular said that they'd used the underspend from the creative education course to actually top up and be able to buy access to the creative education CPD website for all staff in the school. So that was really interesting and a really good use of that money as well, I think. So I will stop sharing and just see if anyone has any further questions, anything we haven't covered that you're still thinking, I'm still not sure about this though, or what else we can help you with. Yeah, Julie.
Yes, just asking, you mentioned the Wellbeing Award. Is that a West Sussex initiative or is it a national?
There are several national wellbeing awards. I can send those out to you. We are looking in the future to do a kind of West Sussex wellbeing kite mark. That will come probably in about a year's time. At the moment, I'm working on putting together the whole school graduated approach for all schools in West Sussex. But the wellbeing award is in my job description and will be something I'm working on next year.
Okay, lovely. Thank you.
Okay. Any other questions, thoughts, or comments? Yeah, Pete. You're on mute, Pete.
Yes, I'm glad I made it in the end. But yeah, thank you, Charlotte. No, it's just useful, and so the chats I've had with Greg as well is really helpful, and just starting to formulate plans. I think just having them in place is just so helpful. So thank you, and I'll look into it. I think we're doing quite a bit, but I'm never going to the gift horse in maths. So thank you.
Yeah, exactly. That's the thing, isn't it? I know lots of schools are kind of like, oh, well, do we really want to access this? But actually, you're getting paid, you know, the money is there for it. So yes, I'm going to send the PowerPoint out and I'm going to send out a recording as well.
Thank you.
No worries. Anybody else? No, you're welcome. Brilliant. Okie dokie. I'll give you 25 minutes of your time back. Hide in your office and pretend you're still on the call and get some whatever you need to get done that you can't generally get done. But yes, please do get back to me. I think you've all got my email address. If there is anything else that pops into your head that you'd like to ask Charlotte and I. Otherwise, yeah, I will send this recording out as soon as it appears. And I will also send the slides out. But thanks, lovely to see you all, and see you all soon. Thank you. Bye-bye.
Thank you so much, guys.
Thanks for coming,
Bye.
Charlotte.
You're more than welcome. Thanks. Bye.
Bye.